Consider the following. You just received a call that your Aunt Jane is lying in a hospital bed in a coma with multiple broken bones. She suffered a traumatic brain injury in a car crash shortly after she left work. Her prognosis on her condition is very grim, but over the next few days, Aunt Jane begins to recover. Her ventilator is removed, and she even begins to open her eyes. She seems to be recovering, but the hospital staff advises considering end-of-life options. The hospital advocates for hospice, but you, the family, choose aggressive treatment at the hospital instead. In the following months, Aunt Jane undergoes therapy, orthopedic surgeries, and countless tests. Despite this, it becomes clear that she may not recover and is placed in hospice care at home. So, you set up a bed for Aunt Jane in her living room where your entire family can gather to visit her. After many weeks in hospice care pass, your aunt is happy once more, and soon her symptoms even begin to improve. This story was a reality for an anonymous writer on the Hospice Partners website. Hospice must be known as a better option, or else other people like Aunt Jane will die without the dignity they deserve. Good evening. My name is Carlson, and I'll be speaking on hospice and hospital care. I would like to introduce my panelists, Reverend Darwin Boggs of Big Bend Hospice. When faced with a sudden decline in health, such as a heart attack, or a stroke, or a car crash, a hospital is the obvious option where urgent care can be received. But when faced with a slow decline in health, such as diagnosis of cancer or another disease, hospice should be known as the superior option. According to Max Fay, a staff writer at debt.org, living in the ICU on life support can cost up to $10,000 per day. However, at most, hospice can cost around $1,100 per day. Along with this, Medicare and Medicaid both have insurance programs to assist with the costs of hospice. If you have less than 6 months to live and certification from a doctor of such, and a diagnosis of a terminal illness, and you are 65 or older, Medicare will cover 85% of all costs. Under the same peripherals, Medicaid will cover 95% of all costs. And if you are under 65, Medicaid will cover 100% of all costs. By 2060, 98.2 million Americans will be 65 or older. Most of them will have a life-limiting or life-threatening disease, according to Angela Morrow, a registered nurse. Within the next 40 years, it is important to know that hospice is a superior option. Because so many Americans will be in need of medical aid in the future, it is important to distinguish why hospice is a better option. First, let us differentiate between hospice and hospital care.
And I'm president of the National Hospice and Palliative Care Organization. We're here today to talk with you about hospice care. Now, some of you may have had experience with hospice care, some of you may know or have had experience with palliative care. Palliative care is the provision of good comprehensive pain and symptom management to patients who are facing serious or terminal illness. Today we're going to be focusing on hospice care, which is the largest provider of palliative care in this country. About 1.5 million people receive hospice care over the course of about a year. During that time period, Americans such as yourselves probably received the news that the illness that they were being treated for has not been moved towards a curative phase of their illness, but in fact has become terminally ill. If yourself or your loved one has received this news from their physician and they've made a choice or a decision to move towards a more thoughtful, palliative, supportive model rather than curative treatment. The focus is on care, not cure, and the object of hospice care is to provide to that patient and the family enough support to allow the process of dying to take place in as comfortable a setting as possible. Care is also highly identified as being connected to the family as well, because all patients, as they're going through the process of dying, do need to have the love, support, and care of their family members or loved ones. So for hospice as the provider of services, the patient and the family are defined as the unit of care.
A main variant of hospice is location. Hospice can either be residential, which is in your own home, or in a facility that is run by or owned by a hospital. Illnesses that may cause hospice to be needed can include cancer, COPD, ALS, Parkinson's, kidney disease, and many more. In a recent study, it showed that 80% prefer to die at home, but only 20% do due to complications. A recent US Census Bureau showed that 5% of the 49.2 million Americans over 65 today live in hospice. Overall, 20% of all deaths in the US are in hospice facilities. In a 1994 VA Portland healthcare system and Oregon Health and Science University, 23,000 patients with lung cancer were studied. Of these 23,000, 57% of the survivors were in hospice and did not die in a hospital or undergo aggressive treatment. Another way hospice is superior is the faculty care. In a study done by Professor Seal and Professor Kelly at Goldsmiths College in the United Kingdom, it showed that families reported hospice care staff was like a family. There was a better relay of information and presentation of unsavory news. The staff was more accessible and ready to serve, as compared to hospital staff, which translated a too busy attitude and was not always accessible. How family around the deceased are affected is another way that hospice is superior. Stephen Reinberg of Health Day News reported on a 2016 study that showed that only 1 in 5 families, 20%, were happy with the preferences in a hospital. Another study showed that only 42% of families were happy in hospital. However, the other 57% were happier in a hospice facility. Reinberg mentions Dr. R. Sean Morrison of the National Palliative Care Research Center. Morrison said, patients who have access to hospice care have a better quality of death and a more peaceful death than patients in hospitals. Morrison goes on to say that hospice also provides an added layer of support to the family. This added layer of support can take form in something called bereavement care, which is the care of family members of deceased paid in full by Medicare and Medicaid. Bereavement care can be more commonly known as grief therapy, which can take form in recovery groups or check-in calls run by social workers such as chaplains, priests, and even therapists. Accessibility to hospice is growing as well. According to the Center to Advance Palliative Care, 72% of hospitals with 50 beds minimum have a palliative care program, which is an increase from the 67% in 2015 and 7% in 2001. However, hospice is still needed in rural areas. Only 17% of hospitals with 50 beds minimum provide hospice in rural areas, which is a staggering difference from the 90% of hospitals with 50 beds minimum providing hospice in urban areas. Hospice also has many technological advancements that do make it superior to hospital care. One of these technological advancements is virtual reality, which can help emotionally and physically, especially for younger patients. Providence St. Joseph's Health's Trinity Kids Care has implemented virtual reality experiences for terminally ill children. These experiences can send kids through fantastical adventures, like flying through space and swimming with whales. Another technological advancement is artificial intelligence, which can help medically. Artificial intelligence uses programs that are called predictive analytics. This is where the AI uses electronic medical records to predict changes in the patient's care. In an article by Hospice News, it is reported that predictive analytics can help analyze the situation and guide healthcare providers to better perform a function in a scenario. This article also mentions Hospice Source, which provides medical equipment exclusively to hospice patients. Hospice Source provides a predictive analytic program called Service Power, which improves responsiveness to patient and clinician calls. The Service Power system can identify necessary services, recommend the fastest route to the patient, and it indicates which staff members should do what tasks based on their documented skills. AI can also monitor patients in real time. AI uses cardiac, respiratory, and motion sensors and predictive analytic programs such as Service Power to predict worsening heart conditions apnea, sepsis, fall risk, pressure ulcer risk, arrhythmia, or asthma attacks 7 hours before they occur. Another article by Hospice News mentions Timothy Bickmore. Timothy Bickmore is professor of computer and information science at Northeastern University in Boston, Massachusetts. Bickmore is leading a clinical trial for virtual conversation assistants in more than 100 homes of hospice patients. This system alerts clinicians to changes in a patient's health, allowing for a very rapid response. With a tablet, patients can interact with an animated character that can answer questions and give referrals to hospice specialists. This system allows for better social engagement while in hospice care through interaction, telling jokes, and stories, and an optional spiritual module that can help hospice patients handle emotions they may have associated with death and dying. According to developers who are adapting AI to hospice care, costs can be minimal depending on the AI service provider. Most systems are cloud-based, with costs based on usage levels. Savings from increased efficiency, automation, and resource management can help lower overall expenses. A report in 2018 by ABI Research estimated that AI applications could yield an approximate $21 billion in savings by next year. AI is reshaping our health industry to help hospice care providers better care for loved ones in a hospice setting. And with AI only in its infancy, the future is very bright for hospice and artificial intelligence. Hospice is comfort care. The Bible tells us in 1 Corinthians 3, 16 through 17, that our body is God's temple and that we should not destroy it. Hospice keeps our body calm and comfortable as our day approaches for us to die. Also, in James 4:14, it says that our life is short and God wants us to live it to the fullest. So, when you or a loved one is diagnosed with a terminal illness, what will you do? Thank you.
Fantastic, Caleb. I was impressed. Now, the question I have for you, and you may not really have thought about it, but after your study, would you recommend hospice care at the end of life for somebody you love?
Yes, I would. I would say that they should do hospice so that as it approaches for them to pass on, that they will be comfortable and be surrounded by family.
Good. Got another one for you, and you may not have thought of this. Far too many people die outside of hospice care. It's just a fact. Do you have any ideas, have you thought about how might the number of people that are in hospice, that would be in hospice, be increased in the future? Are there any steps that you've thought of that might increase the exposure and the awareness of hospice care into the lives of families who find themselves at this point at the end of life?
Right. Well, obviously with like a sudden decline in health, a hospital is still needed, but I would say like as hospice becomes more and more advanced, like with the technological advancements, that it'll become a more common option. Like right now, not a lot of people know about hospice and they just think like a hospital's the only option, we're just going to the hospital. But I think in the future, as hospice advances and maybe even surpasses hospital care, I think it'll become a more common option.
All right. Thank you very much, Caleb. God bless.